Hello again, everyone, and welcome back. My name is Tom Nelson again, and this is part 3 of the 5-part series on understanding inflammation. Let's learn a little bit more about acute and chronic inflammation. Acute inflammation is very quick to start. It's usually the first thing that happens, and it can become severe in a very short period of time. Again, the symptoms are normally only present for just a few days in acute inflammation, but they may persist up to a few weeks if it's unable to resolve whatever the issue is. Acute inflammation includes minor cuts or scratches, ingrown hairs, toenails. It could be a sore throat, a pain after moderate exercise. It could be acute bronchitis, catching a cold or the flu. It could be dermatitis, acute appendicitis. It could be physical trauma. There's an endless list of things that it could be. So acute inflammation is usually caused by bacteria or a minor injury or chemicals, things that you bring on by yourself. It's usually rapid onset and usually only lasts, again, for just a couple days. The inflammation then improves or resolves that issue as quickly as it can. But if it can't resolve it, and is within a very short, reasonable amount of time, it will become chronic inflammation. And chronic inflammation is commonly caused by pathogens or irritants that the immune system just simply can't remove or break down, or if you just keep reintroducing them so that the immune system never really gets ahead of it. So it's usually slow to be resolved if it's chronic, and it could continue for months, in some cases even years. It often results in tissue death, which produces a thickening or a scarring of connective tissue. Inflammation may be painless, but especially when it occurs deep within your tissues, but it can also be painful. People often feel the pain, the stiffness, the discomfort, the distress, and even agony can result if the chronic inflammation can't resolve the problem. The amount of pain that will be determined by the severity of the inflammation, and those are the things that can lead to chronic pain, which so many people unfortunately suffer from. So the type and amount of pain can vary. The pain is often described as constant and steady. It can be throbbing, it can be pulsating, it can be stabbing or pinching. The pain is usually caused when the swelling pushes against the nerve endings in the area where the injury is, and that sends pain signals to the brain. Certain biochemical processes begin to occur during that inflammation. They determine how the nerves will react, which is what induces and enhances that pain. So now proceed to part number 4. We're going to learn how inflammation causes weight gain. Thank you for watching this video lesson, and please pay it forward. Share what you learn with others that could use it. Thank you.